Hello everyone and welcome to today's OET Speaking Practice class with me, Alexander. I will be here today to go through some tips related to the OET Speaking exam and also to provide feedback on some OET Speaking practice. That's a nice combination, isn't it? Some speaking feedback. And this will be for both a nurse and a doctor. So what we'll be looking at today is going through some of the ways in which the OET speaking exam is assessed. We'll be looking at ways in which we can improve our performance and also providing general guidance on some do's and don'ts when it comes to speaking. So let me know if you are watching this class live, either on Facebook or YouTube. A very warm welcome to all those who are. I'm broadcasting from the UK at the moment, so let me know which country you're in as well. It will be interesting to hear all the different countries that we have who are watching this class at the moment. So who have we got watching? I can see that Alexi is watching on YouTube. So welcome to the class, Alexi. Great to see you here. Who else have we got? We've got Chizo as well. Hello to you, Chizo. I'm doing well, thank you. How are you doing? And we've got Winwa, who is watching from Myanmar. Hello, Winwa. Fatima is here in the UK, just like me. Hello, fellow UK resident. Ramya is watching. Etha also watching from the UK. Hello to Annabelle, who is watching from the Philippines. And Yanis is watching from Malaysia. Hello to Bashar, Lakshmi, and Tasir. Paul, hello to you, Paul, who is watching from the Philippines. Madzi is watching from New Zealand. And we've got Anna from the Philippines. Stephanie is watching. Maria from Kerala. Sami from Pakistan. Tunir is watching from India. And Iniobong from Ireland. So Ireland close by. Who else have we got watching? So all of these we're watching on YouTube. We've also got Nitya watching from Saudi Arabia on Facebook. And Haris watching from Pakistan, also on Facebook. Hello, we've got Santosh watching. Hello to you, Santosh. And Cornelius is a nurse watching from Pakistan. Hello to you. We have Tina, who's also watching. Shilpa, who is watching from Oman. And Anita watching from India. So great to see so many of you joining the class today. As I was saying, if you have questions, do post them in the chat box, and I will do my best to address those questions throughout the class. Once again, just to emphasize, we're focusing on the speaking exam. So if you have any questions, issues relating to speaking, then we're going to try to deal with as many of those today as possible. Okay, so we will be looking at, to begin with then, some points relating to the speaking. Let us go through the lesson aims for today. Okay. So today's lesson aims will be to learn and review the scoring criteria for OET speaking, to take part in or listen to OET role plays, and to listen to feedback on student performance, and also to give your feedback as well. So with the student role plays, as I say, I'll be doing one nurse and one doctor. So if you're not able to take part directly in the role play, then it's still a great opportunity to listen to a role play being done and to reflect on that role play as well. Reflecting on the performance is a good way to help you to prepare moving into the OET speaking exam. There will also be an opportunity for questions and answers, and I'll try to do those throughout the class. Just to let you know that currently there's 20% off selected OET courses. This is an opportunity to move forward in your OET preparation. If you are looking at your exam coming up in less than a month, then we have an intensive course which is just for you, and I'll share this in the chat box. Head over to Swoosh English if you have your exam coming up soon. We can provide you with intensive preparation. If you're new to the OET exam and you haven't booked your exam yet, then we recommend our deluxe course. As I say, there's 20% off these courses, and the 20% off offer will continue only until Sunday, midnight UK time. So you have just over 48 hours in order to take advantage of this offer. Okay. So let's see who has been joining us then in the meantime. We've got a number of other students. Kawaja, tomorrow is the test. Very excited. I'm excited for you, Kawaja, and I hope that you get the result you're looking for in the test. Best of luck there. It's always an exciting moment, isn't it, when you step into that exam room? So we've got a question from Awais about the speaking criteria. That's what I'll be looking at, Awais. I'll be going through the criteria and giving some information on that. Anu asking, is there any problem if we don't complete the task in time? So this is a common question for speaking. And as I say, I'll go on to look at this in a bit more detail as we go through the class. But no, if you do not complete the task in time, in the 5 minutes given, then you are not penalized for that. Okay, as long as the information that you have been talking about during the role play is relevant. So we'll be looking at more questions going forward. But here's a question that I have for you right now. What do you plan to do when you pass the OET? Let me know. What are your plans once you pass the OET? What are your ambitions and goals? So let me know in the chat box. Okay, as I'm waiting to hear what your plans and goals are post OET, I can see that we have another question here. It's about fillers. So Cornelia says, I speak naturally with a lot of fillers, even with my mother tongue, and it's affecting my OET speaking score. How can I overcome it? Yeah, so the important thing for the OET is to use professional language. So if you're speaking with fillers all the time, the problem is that this could come across as being too casual and not professional enough. So we have to think about communicating in a professional context and certainly reducing fillers. The best way to do this is to use your preparation time. You've got 3 minutes before speaking to prepare your ideas. So if you have clear ideas before you speak, it should mean that you don't need to use as many fillers. So the way that I'm speaking now, for example, I'm not using too many fillers because I have a fairly clear idea as to what it is that I'm saying. And that's the point. If we use fillers too often, it sounds like we're not sure about what we're saying. It sounds as if we might be a little bit confused, and that can be an issue in a professional context. So plan your ideas, and if your ideas are clear in your mind, you shouldn't have to use fillers too often. But record yourself, and notice that you're doing it yourself, because you have to be conscious about these things, as you are clearly, because you've recognized it, in order to be able to make improvements. Okay, so let's see what people's plans are. So Mahesh getting a job. Ali, you're planning to move to the UK. What other plans have we got? Shilpa would like to settle in the UK as a nurse. Ali to register with the GMC. Career advancement, this is Paul's plan. Chizo would like to relocate to the UK as an overseas nurse. Manju would like to work in Australia. Anu would like to work in Ireland. Usha, work in the UK. And Rija would also like to go to the UK. Rita would is looking to get involved in exam planning. So a few different goals here. Okay, great. So these are your goals. This is what you're looking to do once you pass the OET. So what is your biggest challenge with OET speaking? Already we've had some comments on this, because I was obviously responding to the comment on the fillers. So what is your personal challenge when it comes to OET speaking? What are some of the things that you struggle with? Just let me know again in the chat box. Okay, so Ashley says how to reduce speed while speaking. So speaking too quickly. Nervousness, says Super Brutus. How to move on the role play when the subject is not familiar. Confidence, that's come up a couple of times there. Short pauses, mind blocks, flow. How to begin speaking. Repetition, too many pauses. Stammering. Okay, yeah, that's something which can be tricky. How to initially greet or start the conversation. Confidence, monotone. Okay, so maybe a difficulty in terms of English, in terms of having the vocabulary to be able to communicate effectively. Okay, so there's quite a few things coming up here then. So a lot of them are relating to fluency, and also relating to confidence in general. I can see here, yeah, comments, anxiety, stress and confidence, time management. Yeah. So this can be obviously a challenge. You're walking into an exam room. Of course, you're going to feel nervous. That's the most natural thing in the world, that you be nervous about the experience. But this is your opportunity. So just to say, when you get into the exam room, you will have 2 minutes to warm up. So the idea of the warm up is that you get used to speaking English. It helps you to relax a little bit. And then once you've had the warm up, you have 3 further minutes to prepare before doing the first role play. Then you'll have another 3 minutes before doing the second role play. So when you get into that exam room, of course, you're going to be nervous. Of course, you're going to be tense, but there will be a warm up period. And during that first 2-minute warm up, you will not be assessed. So that's your opportunity to kind of get comfortable, try to relax, and to get used to speaking English. But one thing that I would say when you've got your exam is that you should try to speak English as much as possible before you get into the exam room. Try to get into the habit for that day. Try to get your brain thinking in that language as much as possible. So then you're not making an adjustment when you get into the exam room. You've already tuned yourself up to speaking the language. When it comes to fluency, the key is obviously to speak in a way which is clear. Don't speak too quickly or too slowly. To be honest, though, if you're speaking too quickly, that's a better problem to have than to speak too slowly, because it's easier to slow your speech down than it is to speed it up. So if you are speaking too quickly, then you can practice beforehand, just trying to slow things down a little bit, just to try and make sure that your ideas are clearer. And also, you can use particular language such as sequencing language. So this is language such as, if you're giving instructions, you can use phrases such as, firstly, you should do this. Once you've completed that, you should do the other. After that has finished, you should then do the next step. And if you're using these sorts of phrases, particularly when you're giving instructions, then that will naturally just help to slow you down a little bit. So, yeah, this is the key, isn't it? The key is to find a way to relax ourselves, and that's what the first 2 minutes is about in the warm-up, to try and help us to do that. And also doing things like this class, practice activities, will give you more experience, more exposure to the exam, and that should help as well to reduce those nerves. The more you do something, the more confident you feel. So, okay. So it's interesting to hear the challenges we've got. Obviously, we're going to do some practice today, so we can have further feedback with that, and we can look at that in further detail. So there are two sets of scoring criteria. What are the two sets of criteria? Remind me, what do they relate to? Can we remember? What are the two criteria? Or the two sets of criteria, I should say. Okay, thank you very much, Nanda. They are linguistic and clinical communication criteria, absolutely. So let's have a look at these then in a bit more detail. So the linguistic criteria, there are 4 of them: intelligibility, fluency, appropriateness of language, resources of grammar, and expression. And you can see here a short description as to what is involved in the criteria. So for intelligibility, this is the impact of your pronunciation, intonation, and accent on how clearly your listener can hear and understand what you're saying. For fluency, the description is the impact of the speed and smoothness of your speech on your listener's understanding. Appropriateness of language, the impact of your language, tone, and professionalism on your listener's understanding and comfort. And for resources of grammar and expression, the impact of your level of grammatical accuracy and vocabulary choices on your listener's understanding. So those are the linguistic criteria. We'll look at a summary of those going forwards. For the clinical communication criteria, we've got relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. So we can see for relationship building, this is about the impact of your choice of opening to the conversation and demonstration of empathy and respect on your listener's comfort. For understanding and incorporating, you've got the impact of how fully you involve the patient in the conversation and your listener's understanding and comfort. And then for providing structure, the impact of how you organize the information you provide and introduce new topics for discussion, the impact of that on your listener's understanding. Information gathering, the impact of the type of questions you ask and how you listen to the responses and how that impacts the listener's understanding. And finally, for information giving, the impact of how you provide information and check this information is being understood on your listener's comfort and understanding. So those are the 9 criteria, 4 for communication, for linguistic, I should say, 4 for linguistic criteria, and 5 for communication. But here is a summary. So this is a way to assess whether you have achieved these criteria successfully. So for the linguistic criteria, the question to ask is, did the speaker speak clearly and was the speaker easy to understand? Okay, if they were, then they were intelligible. Did they vary their pronunciation and intonation relevantly? Okay, that also relates to intelligibility. Did the speaker speak fluently and smoothly with few hesitations and full starts? So obviously that would relate to fluency. Did the speaker use appropriate language and tone? So that's appropriateness of language. And did they use relevant and correct vocabulary and grammatical structures? So there you have the resources of grammar and expression. Looking at the clinical communication criteria, there are 5 of them, but we can summarize them even more succinctly. We can ask the question, did the speaker speak in a way that offered empathy and support? Many of the clinical communication criteria relate to empathy, reassurance. So if we're using empathy and reassurance throughout the role play, then we will be showing a good level in a number of these criteria. Did the speaker listen to the patient and respond effectively and appropriately? So that's going to relate to information giving, listening to what the patient has to say, and then giving the appropriate response. Was the delivery of information structured appropriately? So obviously there you got providing structure. And was the patient satisfied with your delivery of information? So again, you've got that information giving element. And also you've got incorporating the patient's perspective as well. That's going to be involved, isn't it, in giving empathy and support. So these are the key questions to ask yourself, and you should use these questions as a way to assess whether you are doing what you should be doing in the role play or whether you have missed something. There's something in your performance that you need to adjust. So I can see we're being joined still by new students. We've got Omer. Hello, Omer. Welcome to you. Okay, so these are the criteria then. And as I say, this is a way that you should judge whether your speaking has been effective or not, answering these questions. What we're going to do now is some speaking practice. So we're going to start with nursing. So I'm going to share the link for those to join the class. If you are a nurse, I'm going to share that now. So if you would like to do some speaking practice today and you are a nurse, then do click on the link, which I'm going to share in the chat box, and you will be able to join the class through that link. So I've shared that now. Let me know if you have your test coming up very soon. Some of you were saying you have your test coming up tomorrow. So if that is the case, then do let me know, and I will try to prioritize candidates who have their test coming up very soon. Also, if you would like to join the class, please do access your camera. It's always more interactive if you can actually see the person that you're communicating with. So there you go. I've shared the link now in the chat box. So all you have to do is click on that link if you are a nurse and you want to do some mock speaking practice today to get some feedback on your speaking. Then just click on that link and I will be able to bring you in. Okay, so I can see that we've got some students now who have joined the class live. As I say, please do access your camera if you would like to do some speaking practice today, and then I will bring you into the class to do so. I can see we've just got a few questions coming through. So does stammering affect the assessment? If it's a problem, so if it's a condition that you have, if stammering is a condition, then that ought to be declared before you sit the exam, and that can be taken into account. If it's something you're doing because of nerves, then yes, it would affect your score, because that would be seen as being an issue with fluency. Okay, so I've sent the invitation link now to join the class, and I'm going to bring one of the students in who has joined. So let me do that now. Hello there, Paris.
Hi. Hi, Alexander.
Hi.
Good afternoon.
Hi, good afternoon to you.
Yeah, good afternoon. But I think I don't have video.
Ah, you don't have the video.
Yeah, I'm using my phone only.
Okay, and there's no way on your phone you can get camera access.
Um,
Oh, oh, we've lost Paris. Okay, I'm going to bring Mahesh into the class. Unfortunately, we lost Paris there. Hi there, Mahesh. Are you there?
Hello.
Hi, how are you doing?
Yeah, it's good.
Good, good. I'm glad to hear
Yes,
it. Do you have your exam coming up soon, Mahesh?
yes. Upcoming September 11th on my exam.
Okay, wonderful, wonderful. Are you able to access your camera at all?
Okay. Yes.
Brilliant. Okay, so where are you at the moment, Mahesh?
I'm in home. I'm from India. Basically, I'm in Bangalore.
Where is that? Sorry.
I'm from India.
Oh, India. You're in India at the moment.
Yes.
Okay, and what are your goals when you pass the OET exam?
After passing, I want to settle in UK or else Australia to settle my life.
Sorry, it's the connection's not so clear. Could you repeat that?
Hello. Hello.
Hi,
Hello.
can you hear me? No? Okay. Okay, so we're having a few technical issues, it looks like, here with the connection. So anyone else who is a nurse who would like to do some speaking role play today, please click on the link. I'm resharing it now in the chat box. So do click on that and we can do some practice. I can give you some feedback on the elements of your performance which are going well, and some things as well which could help you make some improvements. Okay, I can see that Ligi has joined us in the class. Let me bring her in. Hi there, Ligi.
Hi, sir.
Hi, how are you doing today?
Fine, sir. How are you?
I'm doing well, thank you. I'm doing well. Which country are you in at the moment?
Actually, I'm an Indian, but now I am working in Kuwait.
Okay, okay. And how is life in Kuwait?
Yeah, it's good, sir.
Good, good. Okay, so Ligi, can you see the roleplay card on your screen?
Yeah, yes, sir.
Brilliant. Okay, so you've got 3 minutes, Lizzie, to read the card and to prepare your response, and then we will begin the role play. Is that okay?
Okay, sir. Thank you.
Brilliant. Okay. So for those watching the class, also do read the role play card. Make some notes in terms of how you would prepare for this particular role play. Okay, Luigi, are you ready to begin?
Okay, sir.
Okay, so please begin the role play.
Hi, good morning.
Morning.
I am Liji Biju, one of the registered nurse working in this hospital.
Okay.
Could you please tell me your name and your child's name for my better documentation?
Yeah, my name's Alex and my son is John.
Okay, Alex. Could you please tell me what brings you here today?
Well, I'm here because I'm here to see the doctor. My son, he's not been breathing properly, and I'm really worried that he has asthma. So we've been waiting here now for the past hour, and we've not been able to see the doctor yet. And I'm just really worried about the condition that my son is in.
All right, Alex. I can understand your concern. No need to worry about the situation. Anyway, you are in the right place. We are here to help you.
Yeah, but how long will I need to wait for? Because if my son's got a serious condition, he should be seeing a doctor, shouldn't he?
Sorry for the delay, Mr. Alex, because our doctor is in the emergency department. He is little bit busy, so he will come and visit your child as soon as possible. If you don't mind, let me examine your child, please.
No. Well, yeah. I mean, you can examine my child, but I need you to tell me: is my son, is he suffering from asthma?
Yeah, I can understand your concern as a father. Um, I already informed the doctor. He will come now. He's busy with some emergency in our emergency department. That's why I'm really so sorry to tell you that.
Yeah, but I think this is an emergency as well because as I was saying, he's not been breathing properly. He's been experiencing chest tightness. He's been wheezing as well. If you can't breathe, then
Yeah.
that's an emergency, right?
Yeah, I can understand your concern. Anyway, by examination, I can feel the same thing for your baby is having chest tightness, wheezing, and dyspnea also. Anyway, doctor will come now and he will, by medical assessment, he will diagnose what is the disease for your baby, what the present
Can you
condition
tell
for
me?
your baby.
Can you tell me what it is? Can you tell me, is it asthma?
Yeah, he will confirm the diagnosis and he will provide for you some medicines for your baby. No need to
So
worry about the situation.
so you can't. Well, yeah, but you don't know what the condition is, right? Because you can't tell me if it's asthma or not, can you?
By assessment, I can understand your child is having wheezing and dyspnea. Anyway, the doctor will come and he will diagnose the medical diagnosis and he will provide for you the medicine. Is it okay for you?
But I want to see the doctor right now.
Really, I can understand your concerns. You are more tensed about your baby. He will come and he will provide for you the medicines now. No need to worry about your child's situation. Your child is stable now. No need to worry. The doctor will come and attend your child very shortly.
Very shortly or now?
He will come within 5 minutes, like that. He will come. You can just relax and you can keep the baby in a correct position. I will just take your baby's vitals and I will inform to the doctor and he will make the diagnosis for your child. How does it sound?
Oh, well, I want to see him now. I've been waiting for more than an hour, so just make it happen now, please.
After taking I came here to check your baby's vital signs. I will check the vital signs and inform the doctor and he will come. Is it okay for you?
Okay, we'll take the vital signs.
Okay, thank you for allowing me to take the vital signs.
Okay, we'll
Yeah.
stop there, Lizzie. We've just reached the 5 minutes. But yeah,
Okay, thank you, sir.
no worries. So this was obviously a bit of a tricky one because the carer was agitated, and so that was a major part of the role play, having to manage the agitation of the carer. So I thought, you stayed calm, you stayed polite, which was really important. And so it stopped, obviously, there being more of a confrontation than there had to be. You went through the tasks, so you explained that the doctor was busy in the emergency department. You asked for an explanation of the child's condition. I thought maybe one of the criteria is information gathering. So maybe you could have asked a few more questions at the beginning just to really establish what the situation was. You did ask the question. You said, could you tell me the condition? And I talked about difficulty breathing. But you said, are there any other symptoms? Has has your son been displaying any other issues or difficulties? So maybe we could have asked a few more questions there. But you explained what the doctor would do, so we went through that task. You reassured the parent you're doing everything that you could and that the doctor would be there shortly. And then also encourage the parent to relax and explain that you needed to continue taking the signs. So you did a good job of sticking with the tasks throughout. Just a few things. No worries. So just a few things. At the beginning of the role play, remember, one of the criteria relates to how you begin the role play, so relationship building. And you began by, greeting and asking for names. But I think, bearing in mind the fact that the carer had been waiting for a long time, it would have been good to start with an apology right from the beginning, just to say, so you can see the first task, explain the emergency department has been busy. So you could even sort of right from the beginning say, look, I'm really apologetic, or I'm really sorry that you've been waiting for so long. I know that this must be a difficult experience for you, but I can assure you the doctor will be with you as soon as possible. In the meantime, could I please find out more about the condition that your son has been experiencing? So something like that right at the beginning, just to try and sort of anticipate the carer's concerns. I think that would really help in terms of building relationships at the start. So there were some good uses of empathetic language. You said, I can understand your concerns. You did apologize as it went on. You said, I'm really sorry. But avoid expressions. You said, no need to worry. Avoid expressions like that, because that could sound as if you're not being empathetic, as if say, there's no problem here. It's fine. No need to worry. I think, it's better just to say, you're at the moment, your son is stable. I can assure you of that. And your son will be assessed, obviously, as soon as possible. A doctor will be with you shortly. So, just be careful with some of the language that you use, because sometimes it could be a bit inappropriate to say, no need to worry, particularly if you're repeating it as well, because if you repeat it, it makes it sound less credible as well. So, just be careful with that. And generally, your language was appropriate, though. You were certainly resources of grammar and expression. You were accurate. You spoke in a fluent way. You were intelligible throughout, so there were no problems there. But you did use dyspnea on a couple of occasions, which is not a common lay term. So obviously on your card, you can see that it has that as a symptom. But rather than dyspnea, you'd want to say shortness of breath, or use a more sort of common lay term rather than a term that would be maybe confusing to someone who's not familiar with medical terminology. But okay, so lots of positive things there, Lizzie. But just a couple of points as well to bear in mind going into the exam.
Okay, thank you, sir.
Okay,
really,
thank you.
Very nice experience.
Good. Great to have you part of the class, Lizzie. Take care.
You, sir.
Cheers. Okay, so any comments? How to show empathy? We've got here. Well, empathy was shown by Lizzie there when she said, I can understand your concerns. I'm really sorry. It's basically trying to relate to the patient's experience. I can see here some comments. We've got I truly understand that you are really worried regarding your child's condition. However, I'd like to reassure you that he will be okay. Yeah, perfect, Letetsky. Yeah, that's a really nice way of expressing it. I'm so sorry for the delay due to the emergency cases are currently happening right now. Don't worry, I'm a child's nurse and I'm going to take care of your child. That's nice as well. Before proceeding further, would you mind if I ask about your child's condition so that I can monitor this or have more information about this? Would be good, yeah. Rather than sort things out. I wouldn't say sort things out. It sounds a bit too robotic, maybe not empathetic, but definitely some really good language you were using there. So the assessment questions, what do you think? Did the speaker speak clearly and was the speaker easy to understand? Did they vary pronunciation, intonation? Was the speaker fluent? Did the speaker use appropriate language and tone? Did they use relevant vocabulary and grammatical structures? And also the clinical communication criteria. Did they speak in a way that offered empathy and support? Did they listen to the patient and respond effectively and appropriately? And was the delivery of information structured appropriately? And finally, was the patient satisfied with your delivery of information? So in this case, the carer wasn't particularly satisfied, but that wasn't necessarily the fault of the nurse. Some carers or patients are very difficult to satisfy. So just a reminder, we've got 20% off selected OET courses right now. You can take advantage of this until midnight of Sunday. So again, you've got just over 48 hours to do this. The code for this is OET Live 20 off. I will share the code in the chat box. And we recommend, if you are coming up to your exam soon, to take our intensive package. We have an intensive course for those who have their exam coming up soon. And if you haven't booked your exam yet and you'd like to find out more information, then we have our deluxe course, which we would recommend for those who are in that situation. So I'm sharing the links for this now. Only the first 15 people will be able to get this offer. So if you are interested in this offer, do find out about it and get involved as soon as possible to avoid missing out. So we've got the doctor's role play coming up next. I can see that some doctors have joined the classroom. Let me know in the chat box if you have your exam coming up soon. I want to obviously provide opportunities for those whose exams are coming up soon. So I will bring you into the class just shortly. Okay. So in the chat box now, I've shared that information for those who do want to take advantage of the offer that we have at the moment. Remember that the code for this is OET Live 20 off. Only the first 15 people will be able to take advantage. Okay, so let me see who's in the class. Remember, please do access your camera if you would like to participate. And okay, I'm going to bring Akko into the class because his exam is coming up tomorrow. So let me bring him in now. How you doing there, Akko?
I'm doing fine, thank you.
Good, good. Glad to hear it. Which country are you in at the moment?
Actually, I am from Iraq, but I'm here in Turkey to take the test tomorrow.
Wow.
Because there's no test venue in Iraq.
Which country? Okay, so you've had to travel countries in order to make this happen for you.
Yeah, that's it.
Dedication. I like it, Akko. I like it. Good. Can you see the roll card on the screen?
Sorry, I didn't get you.
Okay, so I've shared a doctor's roll card on the screen. Can you see it?
Yeah, yes, I can see, yes.
Perfect, perfect. Okay, Akko, so you're going to have 3 minutes then to prepare, and then you should address the tasks on the roll card. Okay.
Okay, that's right.
Brilliant. Okay. Okay, Akko, are you ready to begin?
Yes, I am.
Okay, so please begin the role play.
Okay, good afternoon. How should I address you, please?
You can just call me Alexander.
Okay, Alexander, good afternoon. I am Dr. Ako. I'm one of the attending doctors for today. Tell me, how can I help you?
Well, the problem is that I've been experiencing quite a lot of pain. I mean, I've always had pain in my right hip. It's caused me a bit of jip for a few years now, but more recently the pain has become stronger, and it's impacting my ability to sort of do day-to-day activities. So I've recently started using a walking stick because it hurts so much, and I'm just a little bit concerned really about whether it's going to continue getting worse and the problems I'm going to have going forward.
I appreciate your concern. Would you mind if I ask you a few other questions?
No, of course not.
How is the pain? Can you tell me the character of the pain?
Yeah, it's just sort of aches really. That's the main feeling. It just, I almost wonder whether it's sort of like arthritis or something like that. Sort of really sort of aching pain.
I see. Is there pain anywhere else in your body, or is just the right hip you have?
It's just in the hip. That's the main problem. I mean, I have sort of general aches and pains, but yeah, the real problem is in my hip.
Have you used any medications for your pain?
Nothing beyond sort of, you know, every now and again, maybe I'll take a sort of paracetamol or something, but nothing stronger than that.
I see. Okay, let me reassure you that pain is quite common, especially in people over the age of 65. Yes, as you mentioned, it could be arthritis, as arthritis is one of the most common causes of hip pain. Is it clear?
So you think it is arthritis?
I say that we have to perform some examination and go for some tests so that we can diagnose your condition.
Okay.
Does that sound fine to you?
Well, yes, I can understand that. I just wondered, you know, you could tell me sort of why it's getting worse. If do you have any idea why the pain could be getting worse?
Yes, I see. Yeah, actually, we haven't made a right diagnosis yet. We have to perform examination and go for tests to diagnose it. It might be arthritis, as I mentioned, or it might be other conditions like what's called bursitis, tendinitis, and referred back from other places like from your back. Is it clear? And
so, okay, so it may not be arthritis then.
yes, like that. And you asked about why it gets worse, yes?
Yeah.
Yeah, the possible reason might be because of an unrecognized condition, unrecognized cause, and it has remained untreated for the past, I don't know, time.
Okay. So you said that there'll be some tests. What kinds of tests then?
Yes, we can perform physical examination, and for the tests, I can send you for an X-ray to see if you have got arthritis or any other possible causes. Do you think you can do that?
Yeah, well, I don't want it to get any worse, so I want to know what's causing the problem. So yeah, I can do that. And what about treatment? What could happen there?
Yes, there are many treatment options depending on the diagnosis. For example, after the X-ray and examinations, if you had arthritis, we have lifestyle management treatment, like you can lose weight, you can modify your activities, use painkillers like paracetamol, NSAIDs, and then you can have a regular physiotherapy.
Okay, I'm just going to stop you there, Akko, just because we've run out of time on the role play. But yeah, so we were getting into it there, weren't we, in terms of the treatment options to provide more information to the patient. So a few questions that came up there were related to finding out the patient's names. I just want to address this as I'm talking to you now. So obviously you asked how may I address you right at the beginning, which is fine. That's no problem at all. Or you can do it during the 3 minutes as well. So that was just a question that came up a few times. So yeah, either you could do it right at the beginning, or you could do it during the 3-minute preparation time. So I thought you started off nicely in terms of gathering lots of information. You know, you try to find out as much information as you could from the patient, which was good. But obviously the patient was communicating worry, concern over what was leading to the pain. So I thought maybe more reassurance could have been used to help to try to build that relationship with the patient. So expressions such as, you were saying that it's common, you were saying it's common for people over 65 to experience hip pain, and it could be arthritis. But obviously the patient was worried about the possibility of arthritis. So maybe something such as, it's not unusual to experience a bit of hip pain as you get older. It could be that this is arthritis, but there are a number of other potential conditions as well. But at this stage, try not to be too concerned because of the fact that it's not abnormal to experience this pain. This is something that is quite common, and there are potentially a number of treatment options that can be used. So I think, sort of providing more reassurance and a little bit more empathy in that sense, I think would have been beneficial for the patient. So yeah, that's the thing. So the information gathering, good, but do make sure that you're providing sort of reassurance and support where possible, just to try and keep the patient at ease, to try and deal with some of their concerns. We were trying to go through the tasks, so but I felt the order of them sometimes was a little bit disorganized, just because you started talking about tests before we'd established the reasons. So if you look at the order of the tasks, you got, first of all, explaining the possible causes, then give reasons for the worsening of the symptoms, then inform the patient that the pain is quite common for people over 65, then explain physical examination and tests. So you were looking at that task before we'd completed the other tasks. It's always best to go in order, because the way that the role play is structured is that the patient role card will have a task that's related to the first task in the doctor's role card, and then the second task will also be related to the second task in the doctor's role card. So if you go in a different order, then it means that the information is going to be a bit disorganized. So yeah, do try to follow the order of the tasks as they are written on the role card, because it helps to provide more structure to the interaction. And so that would have been helpful. In terms of intelligibility and fluency, that was really strong. Your fluency was at a good level. You certainly were intelligible throughout. Just in terms of pronunciation, you said I think testes rather than just tests. Well, that was just one thing that I noticed just on pronunciation there. But otherwise, the intelligibility was fairly strong. But as I say, I think there was a lack of structure. And sometimes if there is a lack of structure, it means that you're not able to develop as much in terms of your ideas. And by the time, obviously, you were developing in some of the later tasks, unfortunately, we ran out of time a little bit. And I think the reason we ran out of time was just because the structure to the interaction wasn't completely clear. So we were sometimes going this way, and then we went a little bit further back that way. And you know what I mean? So because of the fact you were talking about tests before I'd finished talking about my concerns about the condition. And so when I finished talking about my concerns, then I was ready to talk about tests. So we had to repeat a little bit, and then it meant that we couldn't make as much progression. So that's why kind of having that structure and going through the tasks in the order that they appear is so important. It really will help you to complete the tasks, or at least get closer to completing the tasks, and it will help to provide a better progression as well to the role play. So yeah, I think so definitely there are good things in there, Akko. I think sort of linguistically you're showing a good level of English. When you go into the test tomorrow, my recommendation is just think about structure. Think about going through those tasks in the order that they're presented. Think about providing more reassurance and empathy, because whatever the scenario will be, there will be moments where there'll be opportunities to provide reassurance. Just things like saying, this is a common situation. This is something that many people experience. There are a number of treatment options that we can provide. Obviously it depends what the scenario is, but just think about how you can reassure the patient and show empathy. And if you're able to do those things, then definitely that would show a good level in terms of the communication criteria.
Thank you. May I ask you a question, please?
Of course, yeah. Yes, Akko.
What have I passed if this practice was tomorrow at the venue?
I think if you're looking for a B, right, an OET B, I think because of the clinical communication criteria, it probably would have been lower than a B. So that's not to say that means tomorrow you're not going to pass, because if you do provide more structure, that will improve the clinical communication criteria scores. So just because there was a lack of structure that it probably would have been just below a B on this occasion, but you can improve that. You can do it differently tomorrow, and you'll get 2 role plays as well. So even if one role play is not perfect, if you're better in the second role play, then that can be the difference sometimes between getting a pass, getting a B level and getting lower than a B level. So yeah.
Thank you.
Okay, no worries, Echo. Best of luck tomorrow. Hope it goes well for you.
Thanks a lot.
Take care. Okay. So Fatima asked a question. If I have no idea about the condition card, how can I manage it? You can see, Fatima, on the card, there's lots of information that you can use there. So use the information on the roll card, but paraphrase it. Don't just say the words as they appear on the roll card. That actually was another point there, Echo. Try to paraphrase. Try to use your own words, your own expressions, because obviously you should be using lay terms in the exam to make sure that you are able to communicate effectively. Okay. So apologies to those who I wasn't able to get involved today in the practice. We will be doing more role play speaking next week. So there will be an opportunity there. And if I wasn't able to get you involved today, obviously I can only bring in 1 doctor and 1 nurse. Hopefully I will be able to bring you in next week. Okay, so how do you pass the exam first time? You need motivation, you need time, you need the tools. You also need the support and the feedback in order to get over the line. Do you have all of these right now? If not, then we can help you at Swoosh English. 20% off selected OET courses only for the first 15 people who sign up. The code for that I will share in the chat box. It is OET Live 20 off. So if you are looking to be serious about passing your exam and you do not have the tools and the support that you currently need, we at Swoosh English can provide you with that. Just head over to www.swooshenglish.com today and you can take advantage of this offer. So we will be doing more OET mock speaking practice next week. So if there are any questions that I've not been able to address today, or if you wanted to do role play practice, then there will be an opportunity for that next week. In the meantime, if you want to find out any more information about what we do here at Swoosh English, then please do click on the links that I'll be sharing in the chat box. And I'll just share those now. Okay, so just before we stop there, I've got a question. How do we conclude the role play? So you may just run out of time. That may happen. If you don't run out of time, if you've covered everything, then you can conclude the role play by summarizing the key points, just to make sure that the patient has followed your ideas clearly and effectively. That is a really good way to end the role play. Okay, so I'm sharing the links now and the code if you would like to take advantage of this great offer. I'm going to share as well. That is OET Live 20 off. Okay. So best of luck to all of you who have your exams coming up. I will be back next week with some more role play practice. Until then, take care and enjoy your weekend.